Hello, and thanks for tuning in to this episode of R&R's Ask the Expert. I'm your host, Valerie King, R&R's editor-in-chief, and I'm joined today by Dr. Gene Cole, who's Director of Research for LRC Indoor Testing and Research. That's in North Carolina. He's also a former professor of environmental health sciences at Brigham Young University. Now, Dr. Cole has more than 35 years of applied research experience with emphasis on identification and reduction of pollutant reservoirs and sources, also bioaerosols, residential and workplace exposure assessment and control, product evaluation, cleaning and restoration, mold and sewage remediation, and biocides. He's a member of the Science Advisory Council of the Cleaning Industry Research Institute, also known as CIRI, and he is also a fellow of the American Industrial Hygiene Association. Dr. Cole holds a Master of Science in Public Health Microbiology and a Doctor of Public Health in Biohazard Science and Occupational Health. Months ago, in an intro chat with Dr. Cole, he shared a series of intriguing stories that stick with him, and those stories really spoke to the health and safety of restoration and remediation contractors, plus their customers, both during and after projects. So, we invited him on to share some of those stories and really the lessons they teach. We also wanted to check back in with him on the COVID-19 pandemic 2 years after its onset for advice on effective cleaning and disinfection. Thank you so much for joining me, Dr. Cole.
Thank you very much, Valerie.
Absolutely. All right, first, to add a little bit to my intro, could you share a bit more about yourself and how your experience holds relevance to restoration and cleaning professionals?
Well, thank you. Sure. Um, my background, of course, is in the broad sense, public health, but more specific. It's focused on health and safety from a number of different perspectives, both the public and those who enter indoor environments or various workplace environments um, that may have exposure to a variety of potential hazards, be they biological, chemical, radiological. And the research that I do is applied research. So it often involves sampling, analysis, assessments within workplace environments, whatever the business, the production facility is addressing. It's a matter of determining why are some individuals at risk, why have some become ill, what are the potential exposure routes, and that sort of thing. My introduction to the cleaning and restoration industry, to include those that do specialized remediation, began 31 years ago in 1990. And I was directing a study that was sponsored by the US EPA, and the director at that time of the EPA's indoor air quality program was Dr. Michael Berry, who subsequent to that time became an influencer, let's say, within the cleaning and restoration industry. Um, and so this study was conducted in Denver, and to this day it's referred to as the Denver study. The overall goal of the study was to determine, relative to indoor air quality in an indoor environment, um, what particular monitoring instrumentation could be taken on site. Um, we determined a spectrum of instruments to do airborne monitoring for particulates, for volatile organics, for biological mold, bacteria, dust, for example, and determined to put those instruments together in an indoor air quality test kit that could be taken by professional investigators, even restoration and remediation specialists, uh, to gather evidence and data and information as to what's happening in that environment. In order to generate some potential pollutants, Dr. Berry suggested, with his interest in cleaning and restoration, that we evaluate a series of different carpet cleaning technologies. Remember, his wife had at one point owned a carpet cleaning business, and So he made arrangements in Denver for us to work with a professional cleaning and restoration company that did carpet and upholstery cleaning, water damage restoration, mold remediation, sewage backflow remediation, and so forth. And so we worked in a variety of indoor environments. We would set up the instrumentation prior to the carpet cleaning um, mode, what that was. And I mean, there was steam cleaning, hot water extraction, there was bonnet cleaning, there was dry carpet cleaning using an organic material sprinkled on the carpet. And so it was just, at the time, the five major approaches to indoor environment carpet cleaning. And we would set our instrumentation up beforehand, before any cleaning was done. We would run them for the specified periods of time. Again, volatile organics, dust particulates, mold and bacteria, and so forth, as well as temperature, relative humidity, all the important environmental parameters. And that would take about an hour. Then we would reset all of our instrumentation and give the signal for the professional carpet cleaning company to begin their particular method. And we worked in office buildings. We worked in other indoor environments. There was a school that was very interesting. I may comment on that a little bit later. Very professional bank buildings that have routine cleaning and maintenance. And so that Denver study was written up. It became a technical report. It was presented at conferences. Abstracts were published and so forth. And while I was in the midst of doing this, and we had a team of researchers that were involved, and I was approached by the head of the carpet and cleaning restoration company who said, you know, we have a lot of concerns in this industry, and could I talk to you sometime about my concerns? So we sat down, and he said, I'm worried about our clients, and I'm worried about my workers. And he said, we're in environments that could be, for example, it's trauma cleanup, and there's blood and body fluids. That's a concern. Are we adequately protected? Exposure to raw sewage, massive backflows, 2, 3 feet deep. Um, and he said, I'm very concerned about these things. And I think we could use your help if, you're willing to assist us. So I said, absolutely. I said, this is what I do. I'm fascinated by everything that your industry is involved with. And he said, well, I'd like to then get you involved. And he said, I'm also a member of the IICRC, and we are working on the second edition, the S500, Professional Water Damage Restoration. And so that was my introduction to the industry, the IICRC. And then I began, well, here I am 31 years later, still working with not only IICRC, but over the years, many other organizations dedicated to cleaning, restoration, and remediation, while continuing to do a series of applied research studies that have helped to educate and inform the industry. And so basically that's it. Again, my main focus has always been transmission of infectious disease agents, but they could also be toxic components. They could also be allergic ones. And then the worker perspective is important too. And in doing that second and third S500, and then of course I worked in the first S520 on mold remediation, and the second edition as well, various issues surface, where I would remind those in industry that these are things you need to address. You really want, for example, a pregnant worker knee deep in raw sewage doing cleanup. And so there's health implications, there's liability implications, there's political implications, gender implications, and these would be discussed, and it would take 3 years, 3 to 4 years, and there'd be a published standard, living document, open for comment, and so I've seen the industry grow tremendously in this regard over the years, having voluntary consensus standards, guidance of various kinds, an emphasis on schooling and training and gaining knowledge and information that helps clients and the public, I think is wonderful. And I've been proud to be a part of that since 1990.
Thank you so much for that background. Yes, I would like to, before we get into some of those stories I alluded to earlier, talk a little bit about that infection control and prevention experience you have through the lens, of course, of COVID-19, which we're still facing. Of course, the Omicron variant is very real in this moment, early January, as we record this. So, going back to late 2020, just as the second wave of COVID-19 was presenting itself, you authored an article for R&R that was titled "The Disinfection Disconnection." I just wondered if you'd be able to share just a little bit about what that article was about, maybe a few key points.
Sure. Well, that article was in response to some other articles that were published in the general media criticizing what they felt was an overemphasis on cleaning and disinfection. And in some cases, that was true, as you could see on the news now and then, individuals, for example, outside of a building spraying disinfectant on a sidewalk or something of that sort. And, that's not following the science and what's really needed to protect. Um, so this article, The Disinfection Disconnection, was again an attempt to bring science into view to help inform people. And to counter the article, it basically said, we know this is an airborne viral disease, and why are we going crazy cleaning surfaces and washing hands and so forth? So what I did was to pull together all of the relevant scientific information, laboratory studies, clinical studies, volunteers inoculated with different respiratory or gastrointestinal viruses and so forth. Um, Over the last 50 years, uh, disinfection of surfaces, prevention of infection, infection control, as you called it in your intro, um, has become very well recognized and developed. And so I cited all of the science behind the need for cleaning and disinfection, and address cleaning as the need to physically remove organic material deposited by individuals just through touching. And I described the um, microbial network, if you will, that's established as we go throughout our day, touching various surfaces. Certainly, our own work environment isn't a problem, but then when we leave that environment, we're touching various door handles, we're in a shopping mall, a supermarket, whatever it might be. We're depositing organisms. Um, Most are bacteria, some are viral, and then we're picking others up. And so it's a constant change of organisms on one's hands, and then particularly with children in school, they're not great when it comes to hygiene, toilet hygiene, respiratory hygiene, and of course they're in school and they're wiping their nose with their fingers and they're smearing it on their desk or other surfaces that other children touch. We know that these organisms can survive for hours and some of them days, and then other viruses, actually weeks and months, depending upon conditions. How much mucus and related body fluids were they embedded in? Um, the organism itself has an intrinsic genetic based capability of survival, either long or short term. So All of this was presented in the article, and the three key points that were emphasized were that we need to give attention in a pandemic, in an outbreak, even just dealing with cold and flu, of three things. And in particular with COVID, it was respiratory protection, and then surface cleaning and disinfection, and then hand sanitization. Last two really going together to provide an almost complete package of addressing contact transmission. That's what's done in healthcare environments. We're not going to eliminate hand washing, hand sanitization of physicians between patients. Surgeons still will scrub up and glove and will clean those operating room surfaces. Well, the home environment is the largest healthcare environment. And so we want people to, in their homes, to clean, to disinfect. Um, if someone is ill with a severe respiratory infection or gastrointestinal infection, both of those can have nausea, vomiting, diarrhea. We want to isolate that family member, put them in a separate room, give them their own bathroom if that's possible, have them do the cleaning, try and stop the spread just as is done in a healthcare environment, especially a hospital. In the article, I emphasize cleaning, again, the physical removal. Typically, the best way to do that is detergent use. Using detergents emulsify soil and organic materials in which viruses, bacteria, fungi are embedded. And actually, that's in essence a form of disinfection if we look at disinfection and define it as a reduction of microbial contamination on hard or soft surfaces. And then that can be followed up with the use of a recognized and effective EPA registered, meaning it's been tested and found effective, against a long list of potential human pathogens as a secondary approach to ensuring we now have a safe surface situation and environment. And so that was the summary. That was the essence of why the article was written and then published, um, because there was misinformation out there. There's still misinformation a lot about COVID. You may have some other questions for me in that regard. But as we stand today, uh, COVID is still obviously a science issue, but over the past year and a half, it's been muddled with being a political issue at the same time. And so we have different individuals citing different science data facts, politicians making decisions on whatever they feel is relevant. And so it's an interesting situation. But the surface contact transmission of infectious disease agents occurs. It's a fact. It has for generations. I mean, going back to Dr. Semmelweis in Austria, really one of the most important pioneers in terms of disease transmission, recognizing how women about to deliver babies were infected, and it was from hand, skin contact by medical students who were doing autopsies and didn't wash their hands because no one knew about contact transmission. And so he was followed Semmelweis by Lister and Pasteur and others. And, have what we have today. So we have the science behind cleaning and disinfection. Now it's just implementing it to the point where it becomes routine. Everyone understands it's something that's necessary. Um, yes, we're dealing with primarily aerosolized infectious disease agents, but we still have to clean surfaces, we still have to wash hands, and that makes, as I said, a whole package of protection for everyone.
Thanks for that comprehensive answer. And yes, I do have a follow up. There may be nothing to add, but do you have anything to add to, what our audience of restoration and cleaning pros should know about effective COVID-19 cleaning and disinfection now that we are 2 years in and we are experiencing this somewhat new variant at this point?
Well, I think we have ingrained the fact into professionals and the general public that cleaning and disinfection is important, it's relevant, it does make a difference. We know that prior to the COVID pandemic, we have dealt with, oh my goodness, a variety and a large number of situations in public environments where disease agents have been transmitted. Prior to the pandemic, we had documentation that tuberculosis, which is airborne, is a bacterial disease, but highly infectious, a pathological concern. It can be life-threatening. It's been transmitted on airplanes. Um, Intestinal disease agents, salmonella, shigella, norovirus have been transmitted in enclosed environments as well. Uh, think about public transportation, buses, subways, and the thousands of people every day that spew forth, respiratory-wise, a variety of organisms. Many may be innocuous, others potentially pathogenic. And this brings up the issue of, well, how do people become infected? And there's really three important concepts here to understand. One is infective dose. And so that means how many, if we're dealing with COVID, for example, how many COVID viruses does it take to actually penetrate human respiratory cells to initiate infection and then replicate and produce illness? Um, we still don't have a clear sense of that, but from the aerosol data that we do have at this point, probably somewhere around 1,000 virus particles that need to be inhaled through the nose or mouth or both. And of course, both are lined with mucous membranes, which make it very easy for viruses to attach to cells, gain entry, and begin to replicate. So infective dose is important. And with COVID, for many people, it may not be a very large number. And so contact transmission could actually be a viable way of contracting COVID. The second point of emphasis, other than infective dose, is the virulence of the organism. That is based on the genetics of the virus or the bacterium. And we have no control over that. And of course, viruses are known to mutate. That's what's been happening. We're all familiar with the Delta mutation. We're familiar now with the Omicron mutation. Now there is a potential, just read today, there may be a pi mutation, a pi variant. And this is not unusual. And this may be jumping ahead again a little bit, but I think that this new coronavirus, COVID-19, and its variants, its mutations that has been since early 2020 will continue to be with us for quite some time and will indeed go from being pandemic to endemic to some extent. And we'll be relying on vaccines and effective treatments and the like. The third point of transmissible infections, besides infective dose and virulence of the organism, is the immune status of the individual. And everyone's familiar now with how it ravaged nursing homes across the country, particularly in New York, as patients with obvious COVID symptoms were placed in assisted living facilities, for example. Well, once individuals get to their 50s, immune function begins to wane, 50s, 60s, 70s, so forth. And this is why they're very susceptible We want to keep those folks healthy. They need greater attention to infection control practices uh, wherever they are, whether it's at home, in a facility, a hospital. Um, so all of these three factors are taken into consideration and used for recommendations on respiratory protection, certainly for workers going into building environments where there's a known illness. Uh, may not be infectious at all, but we're more conscious of that now. And so we rely more on professional cleaning and restoration and remediation companies to do a good assessment beforehand. Exactly what are the details of the illness? Who were the people that were ill? Where were they working? Uh, let's address their workspace. And then questions pop up. Well, is this something that's airborne? How do we address the HVAC system? Does it need to be cleaned and disinfected? Um, and then, of course, you're into administrative approaches in terms of saying individuals need to be quarantined at home, any clearance from a physician maybe to return to work. They need to have a negative test if it's COVID, that sort of thing. So things aren't as simple as they were a while back. Uh, Again, going back to the 1990s, in talking with one of my colleagues who has been very prominent in the industry over the years and still is in terms of education and training, uh, he was commenting on this, how far the industry has come over the decades. And he said, wow, he said, we've come a long way from going in, cleaning a carpet and spraying cherry deodorant. Uh, he said, back then we had no idea what was in the carpet, what came out of the carpet, what was aerosolized from the carpet, um, what the risks were to certain individuals. And of course, nowadays we have individuals who are immunosuppressed for various reasons. They might be on chemotherapy, they're outpatients, but they're staying at home. Well, they've had water damage, mold growth. This is a concern. Um, there's segments of the population that have other illnesses or on other therapies that lowers their immune function, makes them more susceptible. Pregnant women are immune suppressed for 9 months. Um, Half of their immune function is suppressed to protect that fetus. So all of these are elements of concern in terms of what's happening in the indoor environment, whether it's home, office building, shopping center, amusement park, so forth, and how we're going to address the particular concern at the time. Let me stop there because you probably have another question.
Very multidimensional. Thank you for sharing that. Also, the importance of assessment with our contractor audience and not just, executing and doing work without having a very clear understanding of what they're addressing and how it's impacted their customers and the environment they're cleaning and disinfecting. Speaking of that, so we've got a solid sense of COVID, so to speak, and how some things have developed over the past 2 years and what's important to know. Uh, Continuing to look back on takeaways, I love to transition into those number of projects that I talked about earlier that you've been involved with over the years, where restoration contractors maybe made important missteps, maybe they even took exemplary steps, but stories that stick with you in that spirit. So that said, I'd like to hand the mic over to you so you can just dive into a storytelling session, if you will. So yes, Dr. Cole, could you share some of those stories with us and also what their takeaways are for restoration and remediation pros, in your opinion?
Okay, thank you. I'll do my best.
Thank you.
Yeah, this is when I was still teaching at the university. Students would always say, "Do you have more stories? Do you have another story?"
I
And
definitely had that experience whenever we introed. I was like, "Wow, I could listen all day. Such intriguing stories."
Well, let me give you maybe a perspective here. Some things that stand out. Uh, Maybe I'll miss a few over the years, but one had to do with a colleague of mine. Actually, we were in graduate school together. He was an industrial hygienist and was back getting a master's degree at the University of North Carolina in industrial hygiene. And NIOSH was funding his education. And we did some research in the poultry industry, looking at what poultry processing workers were exposed to. A lot of aerosols in the live chicken hanging areas, and then the rest of the processing plant. What are they exposed to? And of course, potential allergens or sensitizers, a lot of airborne dander and fecal material and so forth. And so he became a specialist as I was doing my graduate on biological agents. And then he went back to NIOSH and became their go-to person for biological hazards in a working environment. And he called me one day and he said, I just got a call. And this is a church building, and it's a large one, and it's in the Midwestern US. And they've decided to add a major addition to this building. And so that entails taking on part of the roof of one section. This very old building. And as plans moved forward in terms of how this would be done, it was discovered that bats had been nesting in the attic. And it turns out for years, that attic space, as it turned out, was 2 to 3.5 feet deep with bat guano. Now, many restorers, especially back then, as well as building or facility owners that wanted to cut expenses and do it themselves, would normally get 4 guys and 2 wheelbarrows and shovels. And these guys would be in t-shirts and they would be shoveling it into the wheelbarrows. There's a problem there, obviously. The first thing one needs to think of is what's in bat guano. Well, the most dangerous thing would be a fungus known as histoplasma. Histoplasma can be potentially deadly. It's what we call a thermotolerant fungus. That means once inside the body, it can grow at body temperature and it can begin to initiate an infectious disease process. It can grow in the lungs, and without question, it has a very high mortality rate if not diagnosed and potentially treated in time. So he called me and he said, I know they absolutely have to have good worker protection, full respiratory protection, most likely air supplied protection, full suit, boots, gloves. And he said, but can we disinfect this material before it's removed? And then I informed him, I said, the standard practice at this time is to use a formaldehyde solution. You can't go to bleach because you've got, hundreds of pounds of organic material, which is going to inactivate any chloride solution. So I gave him the references on that, done in the research previously. And we decided that before anything was done, samples would be taken of the bat guano and shipped to a laboratory that could actually determine if histoplasma was there. Back then, and it hasn't changed much to this day, that process involves making a suspension of bat guano and then inoculating mice. And then the mice become ill, and then they're necropsied, and you determine if it's histoplasma or not, and actually isolate the organism. So he went ahead, had the samples collected properly. They were shipped to the laboratory in Michigan. And yes, it took over a month, but it came back positive. Everything was on hold until the determination was made. So again, for cleaning and restoration personnel, they need to know if bats comes up in the conversation where they've been contacted. That's the first thing they need to think of. In fact, from that point on, there were so many bat guano situations he and I communicated about that he eventually, with some colleagues at NIOSH, drew up a document that was published in the early 2000s and was reviewed. No, I think the original one we did was maybe 1987 or 1990. It was just updated a few years ago. It's called Histoplasmosis, Protecting Workers at Risk. And it's available at the NIOSH website, so cdc.gov/NIOSH, and type in histoplasmosis and it comes up. It can be downloaded and it's in English and Spanish. Another similar situation, I guess to tack on to that one briefly, actually resulted in a wrongful death lawsuit. An individual who was working at a medical center, radiology department, and her desk, she was doing administrative type work, was about 20 feet from a stairwell door. And she developed over a period of weeks, months, and then a couple of years, a recurring respiratory problem. It was finally diagnosed as what's known as hypersensitivity pneumonitis. And environmental investigation found that there were pigeons nesting in the stairwell. And so every time that door opened and closed, puffs of air from the stairwell would come in. She had no pets at home. There was no other potential exposure. The number one cause of hypersensitivity pneumonitis is inhalation of organic material, and mainly from birds and primarily from pigeons. Her blood serum tested positive for pigeon antigen. The disease, if it lasts more than 6 months, becomes progressive and there's no effective treatment and the individual dies. It's a horrendous situation. I was called in as an expert witness and reviewed all the documentation, the sampling, the analysis, the medical records, and it was the individual, she was very ill. And before actually the case went to trial, she actually passed away. And so, again, contractors, cleaning and restoration contractors are contacted. Well, we have somebody who's having symptoms, problems. Can you make an assessment, see what needs to be done? So again, birds nesting, animals, raccoons can be a problem. I won't go there. There's a raccoon case that came up. But another one, and you mentioned where contractors either did something very poorly or very well, and this is where they did something extremely well. This was a shopping mall, one of the largest in the country, 1.5 million square feet of mall space. And some 10 years ago, it was completely flooded with river water that was nearby, contaminated with raw sewage. This mall had 32 sewage caps that had blown off when it was flooded. The water was up to 12 feet deep in one end. When the waters receded, it was a massive cleanup. I mean, there were fish in there from the river. It was all Category 3 water because it was river water and raw sewage. It involved multiple cleaning and restoration companies. And the mall was so large and insurance costs so great that there were 5 insurance companies involved. The cleanup was done extremely well. And I had viewed all of the videos, all of the sampling and analysis that was done during the process. Even before the cleanup started, the residue from the floodwaters had to be removed. And I mean, front loaders were brought in. And I think there were 200 and something dump trucks to carry all of that away. And of course, that couldn't just go to a landfill. It's category 3 water, the sewage contaminated, had to go to a hazardous waste landfill. And then the cleanup process started. And the companies involved were very proficient. They followed the consensus guidance that was available to the industry. And they cleaned and they did a terrific job. And mall spaces, there are movable storefronts and doors and wall panels. You can expand or contract the size of any business. And then to a certain point above that, there's just blank ceiling space up to the roof. And so the cleanup cost in the neighborhood of $200 million. And the insurance companies argued, no, we're not paying because there was no need to make this shopping mall too clean. Well, how do you make something too clean? They cleaned from the floor all the way up to the roof. Now, there have been situations where microbial pathogens have contaminated an entire indoor environment, a building or a facility, and later led to exposure of people who frequented that area. So organisms can last for quite some time. We talked about them on surfaces, certainly other material. Over time, yes, the linear death rate, as time goes on, organisms die without moisture, without a virus case association with living tissue, and so forth. That can take quite some time. And you can imagine the extent of the microbial contamination that was in this mall. There were a number of issues, such as how the cleaning should be done. Workers were very well protected in terms of respiratory and body surfaces and so forth. Cracks of storefronts and doors, those were issues. Standing water in those reservoirs. One of the main issues was why clean above the walls? Why clean all the way up to the roof? Well, because the cleaning is incomplete unless you continue. Due to the cleaning, the removal of all of the solid particulates would generate clouds of dust, which certainly contaminate surfaces all the way up to the roof. In fact, when I visited the facility, after it had reopened 2 years later, I was on top of the roof looking down through skylights, and I could see dust and material that had accumulated just in those 2 years. And I noticed that there were over 30 different food service establishments in the mall. So they're storing food, they're preparing it, they're cooking it, they're serving it. And then who comes to a mall? You have X million numbers of people in a mall every year. And who are those people? Well, it's everybody. It's small babies, it's pregnant women, it's, again, people on immunosuppressive medication and so forth. So they are more susceptible to whatever might be there. Once you start moving large volumes of air through a mall, again, you're circulating whatever might detach from surfaces that was deposited from this tremendous river water and sewage sedimentation that was there. It went to trial. I was in for 2.5 years at that point, and the decision was made in favor of owners of the mall, who said we couldn't, with a good conscience, allow people to come back in that mall to open it up if we didn't feel it was clean. We depended upon industry to know exactly how to do that. And they addressed the different types of surfaces, materials, and Um, so uh, the decision was in favor of the mall owners, but then, of course, right away it went into appeal, and I'm not sure actually where that is to this day. There may still be an appeals process going on. It wasn't that long ago that that decision was made. Um, so that was a situation where they did a great job, and um, obviously, certified restoration, mediation professionals came in to give their opinion. You know, was this cleaning excessive? Was it really too much? And they gave their honest opinions, and they documented it based on other jobs that they had done. And then I brought in additional science, transmission and exposure, and so forth. Um, so those are just a few stories that perhaps give some background to how science enters into work that mediation, cleaning, and restoration professionals do. And there's a hunger for that throughout the industry. And it's, again, a lot different now and science-based more than it was 31 years ago when they were cleaning carpets and spraying cherry deodorizer. And now we're in the midst of a pandemic, and all of that becomes very helpful.
Very good. Yes, those are intriguing stories indeed. Unfortunately, we don't have 8 hours because that'd be awesome to just keep going through the list. What a massive, massive project that mall was. Wow. The dump trucks, the cost. Just out of curiosity, what was your role in that? Were you a consultant? Were you working with one of the contractors, the customer directly, the insurance side, some other situation?
Yeah, I was an expert witness on the side of
Ah,
the mall owners,
I see.
and um, there were a number of different remediation contractors, and so I, of course, had to look at what they were doing, and I relied on the expert opinion of others who were independent professionals that came in and went through every area of that mall. Of course, it had been after the fact, but everything at the time of the incident was documented very thoroughly. There were so many videos and photographs, and um, it's not unusual. And restorers and remediators face this in essence on a routine basis. For example, called in to do a water damage restoration, and it may be a mold remediation. But then, in assessing the scope of the job, they find that there's pre-existing mold. Okay, and that's still to this day an issue. Where an insurance adjuster will say, "Well, wait a minute, it has nothing to do with this water loss." You know, well, then that puts the company, the contractor, in a position of ignoring what they realize needs to be done, is still a potential hazard, um, and many of them just walk away in that situation. So information has been generated. The guidance documents have progressed to the point where these things are dealt with uh, to this day. And I won't go into the details, but I was involved in a case from an independent assessor standpoint where the issue was mold in internal wall cavities. And the mold, everything was dry, so the mold was dead. So an attorney, and again, this was a legal case, in deposition said, "Well, Dr. Cole, all of that mold was dead, wasn't it?" And I said, "Yes, it was." "So there's no hazard if it's dead." And I said, "That's incorrect." I said, "Dead mold can be just as much of a concern as live mold. No, it can't progress and produce more mold, but if it's in a wall assembly, for example, depending upon, say, the negative pressure in that home or building, those spores can be sucked out through electrical outlets, under baseboards, and so forth, and in essence, contaminate the indoor air. And they can be a basis of an allergic or sensitizing reaction. They may contain traces of mycotoxins. So we can't say, no, it's not a problem, just leave them there. So anyway, just another offside um, situation that I dealt with. And so I've spent years and decades educating attorneys, a lot of attorneys. Not unusual for me to get a call and they say, well, this is actually a mold case. The first thing I say is this your first mold case? Well, yeah, it is. Okay. First of all, I'm going to send you a list of documents that you need to have and you need to go through to understand what we're dealing with here. Then call me back, see if you're still taking the case.
That's so informative. Wow. Yes. I love that example of working with that attorney and helping them understand the lingering threat of dead mold.
Do
Obviously,
we
very, go ahead.
do we have time for just one more quick? Uh,
Absolutely, positively.
and This was a number of years ago. I got a call from, again, it happened to be an attorney in California. Okay. Lots of strange things happen in California. But so I wasn't too surprised it was California. This attorney said, I'm representing a woman who owns a townhome and she has been experiencing health effects over the past year. And she's convinced that there's some type of contamination coming from the adjacent townhome. And is that possible? And I said, well, sure, it's possible. There has to be a pathway of transmission of bacteria, mold spores, whatever the offending agent might be that she's exposed to in enough concentration and so forth. Chronic exposure. So it is possible. What's going on? He said, well, here's the situation. In the adjoining unit, um, the the adjoining unit was foreclosed. Apparently, the owner didn't pay, and so the bank foreclosed. And they weren't able to contact the owner. They didn't know what happened, and someone they put it on the market, and someone purchased the unit, gave them the key. So this individual opens up the unit, goes in, and finds out what happened to the former owner. That individual decided to take his own life by starving himself to death. And so he got into bed and just laid there until he died. And so the new owner, it isn't a recognizable body, but it's a huge mass of mold growth. And so the attorney said, can you determine by the type of molds that are there when this death occurred? And so I explained to him that no, there's no forensic mycology. It's not like, you know, um, finding fly larvae in a body and then you can say, okay, we know the cycle of these flies and therefore death occurred within, a certain number of days. That's not possible. And so he said, okay, thank you very much. I said, get back to me if you need to. And he never got back to me. But again, that has come up a number of times to me over the years. Can you identify mold and determine how long it's been there? That's something we can't do. It would be nice, but so let me stop there with those case studies.
That's wow. That's a story that sticks for sure. Wow. Um, That this has been great. I don't have anything else other than just the general before we go, anything else of note for our audience of restoration and remediation contractors, especially as they embark on this new year, 2022.
Yes. Well, we're all in the COVID response mode, and that will continue. Surface cleaning, disinfection, adequate worker protection. Um, care and concern for occupants of various indoor environments. And over this past year and a half, I was called upon by industry a number of times to generate protocols. And this included office buildings, airlines, aircraft cabins, amusement parks. Um, think of some of these indoor environments, banks. How many people constantly come in and out of a bank and they're touching all of these surfaces? Um, and of course, we're all concerned about healthcare environments. So I guess the first thing I would emphasize is for cleaning, restoration, remediation contractors, just do a careful assessment. You're called in for one particular reason, but what is the whole environment telling you about this situation? If you need to, bring in someone that has indoor environment expertise. If you need another pair of eyes and another brain or two. Carpet cleaning, um, general cleaning, disinfection, again, HVAC systems, should they be cleaned because there have been 5 cases of COVID or something else? Determinations can be made on those. And again, we have enough guidance out there now since COVID started to address those. The other thing, of course, is protect the workers. So respiratory protection, individuals that do this all the time, yes, it's best to wear appropriate respiratory protection, wear a suit, gloves, that type of thing. Proper immunizations, and it's not just COVID these days, but we're talking about hepatitis A and B and tetanus and so forth, really all childhood immunizations. And then the importance of continuous training and education to workers, staff, and that needs to be continuous. And the industry has done a great job of that throughout COVID with podcasts such as you do, webinars. Myself and my colleagues were very busy over the past year and a half doing those types of things, such as you mentioned one article series that I still continue to be involved with, the Cleaning Industry Research Institute. It's nonprofit. It's there for cleaning and restoration contractors, business owners, and the number of webinars and podcasts and published papers. Series several years ago started the Cleaning Science quarterly for scientific publication of data relevant to cleaning and restoration industry. Is now the Journal of Cleaning Science. In fact, in the last issue at the end of 2021, the Scientific Advisory Council, there are several of us on that. I think we're up to 7 members right now, maybe 8, put together a focused assessment on contact transmission of infectious agents in indoor environments. Obviously with a slant towards COVID, but addressing others as well. And so that's there and it's available to contractors and attorneys. They need help. So we learn from one another. I learned a tremendous amount years ago in the 90s, as I mentioned, sitting on committees for these consensus standards and hearing what these contractors were experiencing in indoor environments and the questions and concerns that they had. And it gave me more of a focus for the research that I would do in the future and assistance that I was able to provide to the industry. And so it's always a very informative process. We help to disseminate knowledge and experience between all of us. Well, I've learned a tremendous amount industry-wise, and they picked up on the science aspects that need to be addressed. And so it's been a good relationship. I've been happy to work with the industry all these years. Obviously, I'm still doing it to some extent, although I'm still really trying to gain 100% requirement. Uh, but it's been a great ride, and I appreciate it. And I thank you for having me.
Oh, goodness. Thank you. Thanks for taking the time and sharing your expertise with us, highlighting the important role science plays, to your point, in the work that our audience does, and even ending with some pointers to some really helpful resources to keep them educated and inspired as they move forward. So, thank you, Dr. Cole.
Thank you, Valerie.
Absolutely. Okay, one more question, and that is before we go, how can listeners connect with you or learn more about effective cleaning and disinfection?
Well, I think about learning more. I would send them. I mean, they already know about professional associations, but the CIRI website, ciriscience.org, and at the bottom there's contact information. The executive director is John Downey, and he's a contractor himself, and will work to find them the information that they need, maybe direct them to one of us on the Science Advisory Council. Others are available if they would like to email me if they have a concern of some sort. I may pass them on to a colleague of mine, or I may be able to interact with them directly. So they're welcome to email me if they have a specific question. That's fine. And my email is Gene, Gene, middle initial, and then Cole, Cole, at Outlook.
Perfect. This has been great. Thank you again.
Thank you.
Absolutely. All right, listeners and viewers, for more insights on restoration, remediation, and the people behind it all, visit our website, randrmagonline.com, also Apple, Spotify, or YouTube. And if you haven't yet, please be sure to follow the podcast, and that's how you'll be able to keep up with all of our latest episodes, usually 2 a week. And if you could give us a quick review and rating and share us with your friends who would also be interested, we'd so appreciate it. We're also on LinkedIn, Twitter, and Facebook, so we invite you to follow us there too. This has been R&R's Ask the Expert. Thank you as always for listening.